am a 20-year survivor of breast cancer, and just showing other women that you can survive this disease gives them hope, a lot of hope.
Breast cancer has been a part of Zora's family tree for at least 4 generations. Her mother, grandmother, great-grandmother, 3 great-aunts, 3 sisters and a niece have all had the disease. In 1984, Zora and other family members took part in a National Cancer Institute study that led to the identification in 1994 of the first breast cancer gene mutation called breast cancer 1 or BRCA1. This gene, often associated with people of Ashkenazi Jewish descent, causes a greatly increased risk of breast cancer. Zora and her relatives who carry the gene also have an increased risk of ovarian cancer.
When there was a specific gene identified for breast cancer, what was the reaction of your family?
My family was very grateful because I think my mom was probably my leading advocate for breast cancer because she always told us that she knew that, she called it a hereditary predisposition for breast cancer. So she always knew that there was probably something going on within our family that caused us to have breast cancer. So all of the terminology that we use today certainly was not used then, but it was the same thing. We knew that there was probably something, a gene of some kind, that caused every single woman in my family, never skipping a generation, to be diagnosed with breast cancer.
And it was her family's awareness of the disease that taught Zora valuable lessons about early detection and early treatment.
My mother used to always say to us, if we used common sense, science would catch up with us. I was first diagnosed with breast cancer at age 31. I found a small lump in my breast during a routine breast self-examination. And I knew exactly what to do. We had a biopsy done, and I was diagnosed with breast cancer. And I immediately went into surgery and had a mastectomy. And I had a good life, so I wanted to live. And I just had an attitude that I was going to overcome this diagnosis of breast cancer.
Zora has a personal mission to educate her own family. A new generation of women has reached adulthood. She has 22 nieces, and they are all at risk for inheriting the BRCA1 gene. In Dallas, Texas, she organized a retreat, bringing her nieces together to discuss their options.
My nieces are very well educated. They know to never miss a doctor's appointment. So I don't worry about them and their health so much. I do worry that they are at risk, and I wish they weren't.
For women who have the BRCA1 gene, the most radical option is a prophylactic mastectomy, where healthy breasts are removed. This is effective in preventing breast cancer in about 90% of cases.
I think prophylactic mastectomy is a choice. It is an option for women who believe that having prophylactic mastectomy may prevent them from having breast cancer. I have a niece who's had prophylactic mastectomy.
Another preventative option for high-risk women is to take tamoxifen, a drug long used to treat cancer.
In Zora Brown's case, for example, if we had tamoxifen out, would that have helped? She sure would have been on it. So we know that tamoxifen in a certain number of women will not only treat it effectively, but prevent breast cancer.
I do everything that I think I can possibly do to detect anything that may possibly go wrong with me. I am very, very proactive. I don't like for anything to be uncomfortable. So the least little problem I have, I am at somebody's door knocking on it and say, fix this, because I don't want to hurt. I don't want to die. I intend to live a long time. And so I am one of those people who believes that if there are things available to you that you can use to prolong your life, use them.